This exercise is a first rib mobilization. So this might be related to breathing, it might be related to a radiculopathy, neck pain, shoulder blade region pain. There's a few different things that we work on this for. Now what I want you to have is some sort of strap or sheet, something that's wide enough that it's not going to put a very pointy pressure onto your shoulder. Something that's long enough that it can go down where your arm can grab it and kind of push down like this. We don't want it so short that you're holding like this. This isn't very good control. So something long enough that you've got that arm down and you can push down with your arm, kind of like you would push down to help lift yourself out of a chair, okay? And so we're gonna get that placed properly. We want it to be pretty close to the neck. We don't want it way out on the edge of the shoulder. We're gonna be doing more shoulder blade. We wanna get in so that we're right at the corner of the neck and the shoulder with this, and that strap going diagonally, okay? You're gonna breathe in and out as kind of the primary movement that you're doing with those ribs. When you breathe in, those scalenes, especially when you do a forced inhalation or a full breath in, right? Not just regular tidal breathing. Your ribs are gonna elevate and those scalenes in the side of your neck are gonna help pull up those top couple ribs, okay? So you're gonna kind of resist that a little bit with your hand, but not to the point where you don't let it happen. I want you to feel that there's pressure here, but as you breathe in, let the hand slide up a little bit with the ribs. And then when you go down, that's really when we're typically working. We're not typically trying to find more expansion. We're typically finding people have less of the relaxation as they come down out of that breath. So that breath in, some pressure on that band, and then as you breathe out, follow down with the hand, so you're kind of helping that rib cage on this side relax down. Then breathe in again, follow it up with your hand over here, and then as you breathe out, let that hand come down and kind of guide those ribs down, okay? And then for the other side, you kind of flip it around. I did not do that smoothly, but that's okay. And then you get that other hand and you hang on, same deal. Let that arm relax down at your side, sit in a comfortable position. And that's that first rib mobilization.